This is Codi Deine, a 27-year-old stay-at-home mum with an 18-month-old child. Her medical history includes back pain, postnatal depression and hay fever, which is treated with medication such as non-steroidal anti-inflammatory drugs, such as aspirin, paracetamol, Nurofen, and fluoxetine.
Hi, how can I help you today?
I've been experiencing a lot of back pain after giving birth to my baby boy. It's made it so difficult to do any work around the house and look after Bub.
I'm sorry to hear that you're experiencing some pain. Have you tried any mild anti-inflammatory medications like Nurofen?
Well, I've been using Nurofen, but it doesn't seem to be having any effect.
Okay, well I would recommend trying Nurofen Plus, which contains the addition of codeine, making it a little bit stronger. Start with 2 tablets, then if your pain persists you can take 1 to 2 tablets every 4 to 6 hours, but no more than 6 tablets per day. Now these drugs are not recommended for long term, but they should help you get your pain under control.
Nurofen Plus is one of many fixed combination drugs that contains codeine. Codeine can be available as a Schedule 3 over-the-counter medication, but it can also be a Schedule 4 or a Schedule 8. Codeine is an opioid analgesic that acts on the opioid receptors in the CNS and gastrointestinal tract. Clinically, it is used to treat mild to moderate acute or chronic pain, cough, and diarrhea. Codeine is a prodrug that gets metabolized in the liver by the cytochrome P450 enzyme CY2D6. In the normal metabolism of codeine, 30 mg of codeine is metabolized to 3 mg of morphine. Codeine, now metabolized to morphine, binds to opioid receptors and induces a signal transduction that stimulates descending pain inhibitory pathways from the brain. These are the same pathways that can be stimulated by endogenous opioids such as GABA, noradrenaline, and possibly serotonin. There is a high density of these opioid receptors in the periaqueductal grey matter, the nucleus raphe magnus, and other midbrain sites. They all work to stimulate descending inhibitory fibers that inhibit pain transmission in the dorsal horn of the spinal cord. Opioids can also act at the local level in the dorsal horn.
Hey, the Nurofen Plus is really helping my back pain, but I've been really constipated lately. Is this normal? Is there anything else I can do about this?
Constipation is often a side effect of products that contain codeine. You could take some laxatives while you're using the medication and try to increase your fluids.
As opioids act on the GI tract and are often used to treat diarrhea, constipation is a very common type A adverse effect. There are also a number of other possible side effects. Opioid-induced bowel dysfunction is another common side effect which can be extremely severe. Long-term use of these analgesics can lead to serious complications.
Codi, I've noticed you haven't filled your prescription with us for a while. Does your doctor still recommend you take fluoxetine?
No, I feel like I've been managing my depression okay without them.
Okay, and not taking anything for your hay fever?
I am. Hay fever season has just been brutal this year.
So your hay fever medications can actually interact with Nurofen Plus, making it less effective. I just want to make sure you're not going over the recommended dose of your codeine medication.
There are some drug interactions to consider when prescribing codeine, and these include CY2D6 inhibitors, opioid antagonists, and monoamine oxidase inhibitors. So selective serotonin inhibitors like fluoxetine that may be used to treat depression are CY2D6 inhibitors, as are many antihistamines such as Benadryl that may be used for hay fever.
Codi, it sounds like you're suffering from chronic pain. Why don't you make an appointment with your GP to discuss? These pain medicines with codeine only provide a short-term benefit, and if your pain is worse when you don't take them, it may be because you become dependent on them.
Welcome back to HS1 News. For tonight's main story, the TGA has decided to raise the schedule level of codeine from Schedule 2 and 3 to Schedule 4. Codeine, a popular opiate used in pain medication such as Nurofen Plus, will now be harder to obtain from February 2018, as it will require a doctor's prescription to access medications containing it. The TGA made the decision because of the addictive properties of the drug due to its opiate nature, its low efficacy, and the potential risk of toxicity for consumers with a fast metabolism.
As a result of too much codeine, coupled with Codi's use of non-steroidal anti-inflammatory drugs, which inhibits the enzyme COX-1 and decreases the amount of stomach mucus produced, she experienced a stomach bleed that required admittance to hospital. Although she required surgery, Codi was fortunately okay and was discharged from the hospital and was recommended she see a psychologist for her codeine dependence. Codi now uses other pain management strategies for her back pain, including physiotherapy, massage, and exercise. She also sees a psychologist regularly to manage her codeine addiction.